Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Today, we're talking about a muscle technique you can do at home called myofascial release. Now, as a disclaimer, I am not certified myofascial release in any of its forms, and there are various forms of this, but I do have massage therapists that have been certified in massage therapy or in myofascial release working for me. I've had the technique done by me, by these professionals, and I've devised a way to do it for myself to help myself at home. So I'm going to show that to you. If you're familiar with trigger point therapy, which I've been teaching for decades to my patients, and there's multiple trigger point techniques on the playlist here on my YouTube channel, this is different than that. Trigger point therapy, you kind of press along a muscle, say on the trapezius muscle here, and you look for a sore spot or a very firm spot in the muscle, and you hold direct pressure on the trigger point to release it. This myofascial release technique I'm going to show you is different. And one of the main differences into why it is a different technique is because the myofascia is a tissue that's not part of the muscle. It's a covering on the muscle. And it's very thin. Imagine a Kleenex tissue just laying over a muscle. And the myofascia should glide along the top of the muscle. And the myofascia is actually one continuous piece of tissue that goes over every muscle in our body. Theoretically, working on the myofascia in one area of your body can help a muscle in a distant part of your body. If the myofascia is stuck on a muscle, it's not gliding, that stickiness of the myofascia on the muscle irritates the muscle below it. So even if you got a traditional massage or did trigger point therapy on the muscle, if the myofascia is not released, the muscle just gets re-irritated again. So if you've had the experience where you get a massage and within hours or a day, that muscle is just tense again, you likely have a myofascial issue that needs to be attended to. I'm going to show you this technique on two separate muscles because I'm going to show you two different techniques. The muscle in your forearm, which if it gets myofascial tension on it, can cause symptoms in your wrist and in your elbow. So think golfer's elbow, tennis elbow, carpal tunnel syndrome symptoms. And the way you can release the myofascia is just to do the skin rolling technique. The skin rolling, as you do it, you might feel something that suddenly feels like a burn. Or you might look at your fingernails thinking, do I have a sharp fingernail? Because it feels sharp. When you feel that, that is the myofascia releasing. So that's a good thing. I feel a little bit right here in my arm, right there, right over this small muscle that just lays over the bone in the forearm. So I'm going to continue to work that by pulling on the skin. This is the easiest way to do this. Now, this is pleasant, but not so pleasant. You know, it's a good kind of pain. Let's put it that way. And because we're working on this myofascia and we're releasing some toxins, you may want to drink a lot of extra water or do an Epsom salt bath. That's one way to do the myofascial release. And remember, this can be any muscle in the body. I could work on my jaw muscle doing the same thing, just like pulling and rolling the skin of my face. It could be on my calf, on my shin, on my thigh. It could be any muscle. It could be up here in the trapezius muscle too. That's one method to use. Another method to use is to use your thumbs to pull the muscle in the opposite direction. And sometimes I'm going to show you this on my SCM muscle here. You would pull the muscle and then make a J kind of motion, like a hook kind of motion. I'm showing you on the SCM muscle because this is a muscle that is associated with emotional stress. And also if this muscle gets any kind of irritation in it or spasm, it can create headaches that will mimic a migraine. They'll start in the back and they'll come around to the front, usually on one side, and also can create vertigo symptoms. So this muscle can wreak a lot of havoc, and rarely do you feel it at the muscle itself. So the way you would work on that, I'm going to use my fingertips here to pull down, and I'm going to use my thumb to pull up. And I'm feeling for something that feels like a stretch or a burn. And right here, I feel a little bit of a burn. So I'm going to go a little bit more slowly. And then what I might do is like do that hook. I'm going to make that J kind of outline as I get near the top of the muscle. And I'm going to keep kind of working the skin off of that muscle. And as you do this and you start to feel that burn, you'll just start to learn how to just keep pushing and pushing. And remember, the muscles attach and anchor into the bones. So you might be actually doing some pulling right over the bone. In this instance, it's right at the base of my skull. So any muscle in the body can get this myofascial restriction. And this is different than traditional massage or trigger point therapy. And the way you do it is by skin rolling or pulling on the skin in the opposite direction along the long axis of the muscle, if you can imagine that. So try it out. Let me know how you do. It's helped me. I hope it helps you. Bye for now. Be well.